Welcome to our Midwifery Care and Birth Center orientation video for Community Birth and Wellness Center. We hear you're expecting. Congratulations. We made this video to hopefully help answer some basic questions about our practice. After you and your partner have watched this video, you will have a private consultation over the phone with one of the midwives. We will answer any remaining questions as well as make sure you're eligible for midwifery care. My name is Rebecca Lucky. I am a Florida licensed midwife since 2012 and co-owner of the practice. A little about us. We opened this birth center in 2018 in downtown Eustis, Florida. We are the only freestanding birth center in Lake County. We have two providers, myself and Del Marie. It is co-owned by Donna Rubens. Donna also is our receptionist, so she's probably done your intake for you. We do offer the same schedule of care that physician-led practices offer. We do prenatal only care for patients that are either higher risk or desire a hospital birth. A little about the midwives. That's me on the left, and Del Marie Howell is on the right. We've known each other for well over, I would say, 15, 16 years now. She was one of my students, and I had the opportunity to train with her for 3 years, and we decided to keep the practice going with just myself and Del Marie. We have a lot of experience in the birth world. Both of us started out as doulas, moved on to assisting and educators as well. Our other team members that you may meet throughout your care. We have Maya Lucky. She runs the front desk. She will be the first face you probably see coming in. She is also trained as one of our birth assistants. And then we have Holly Watson. She will be handling all of your financial questions, insurance questions, and she does a little bit of intake in front as well. Ms. Ashley Jass is our childbirth educator and Wonder Mama of 6. She will be handling all the classes and additional resources that any parents may need for education purposes. We have Dr. Bonnie. She is our resident chiropractor next door. She owns spa, chiropractic, and doula services in the unit 16 next door to us. We have Melissa Yates, who is a doula and birth assistant, works very closely with a lot of our clients to help meet their needs for additional support. And then we have Julie Mudd. She is also a birth assistant. She's been with us for a few years now. We do have a few students. Right now, we are currently taking one at a time. They typically will stay with us for most of their education time, and that could be anywhere from 2 to 3 years. A little bit about midwifery model of care. So midwives are trained health professionals specializing in pregnancy and childbirth who develop a trusting relationship with their clients. This results in a confident, supported labor and birth experience. As trained medical health professionals, midwives provide comprehensive prenatal care and education, guide labor and birth. We address complications, and we also care for the newborn. Our practice monitors the physical, psychological, and social well-being of the mother or birthing parent throughout the childbearing cycle. Proving the mother birthing parent with individualized education, counseling, prenatal care, hands-on assistance during labor, and postpartum support. We minimize technological interventions and identify and refer women or birthing people who require obstetricians' higher level attention. Midwives work towards preventing complications through nutritional counseling, exercise, healthy lifestyle choices, lots of education, and supplement support. Your comprehensive midwifery care package, you will go under several risk assessments throughout your care with us. Our practice reviews each patient's case with our consulting physician and collaborate with maternal fetal medicine for higher level cases. The care schedule for maternity is the same as it would be with any OB or physician-led practice. We offer preconception planning, natural family planning, prenatal confirmation appointments. We also offer additional testing on a case-by-case basis to be discussed with the midwives for your individualized care plan. Pregnancy confirmation visit is usually over the phone, and we do this around the 5th to 8th week. We get your medical intake in. And then we offer diagnostic testing with labs and ultrasound, and we may offer some other information depending on what's going on with your specific case. The official first prenatal in person is around 10 or 12 weeks. This appointment will last around 60 minutes. It includes a physical, if a pap smear is needed, things like that will all be collected at that time. Each visit following that will be approximately 30 minutes. And these are 30 minutes face to face with the midwives. So you definitely want to come a few minutes ahead of your appointment. Make sure you have time to use the bathroom, grab your weight, possibly work on any payments or anything like that ahead of time. That way you get the most time with your midwives. Postpartum care, we do offer in the birth center or at home. It just depends on if you've delivered at home. We typically try to do your in-home visit at 2 days. But if you're delivering in the birth center, we typically have you come back in the birth center. All patients receive a client education binder. It has over 130 pages of information that we constantly are updating and adding to. You'll have a PDF version as well as a printed copy. Partners and children, as long as no one has the sniffles or have been sick, are always welcome to join appointments. Here's a little bit more on diagnostic testing. We get this asked a lot if we offer any type of non-invasive pregnancy testing or NIPT, and we do. We offer through Quest, and we also have a separate lab through Unity. We offer spina bifida. We offer carrier screenings for cystic fibrosis, sickle cell, things like that. We also offer a fun little clinical DNA test for gender that can be done as early as 9 weeks. We are a clinical draw site for them, and that costs an additional $129. We do have a bunch of different options when it comes to gestational diabetes testing. Right now, the favored one has been the Fresh test. It is an organic glucola drink, which has really helped our moms handle taking the gestational diabetes screen and not feel so yucky afterwards. And then moving on to birth center delivery. We are an all-natural facility, and we are all under the guidance of clinically trained midwives. Our birthing suites are equipped with tubs, private bathrooms. We do offer, it's more of a home-like setting with less medical interventions than you would see in a hospital. We have several medications on hand to aid in excessive bleeding post-delivery. We can offer IV fluids, antibiotics, antiemetics, local anesthetics, and do vaginal sutures. We do not offer epidurals or IV pain medication. However, we do offer nitrous oxide or laughing gas for pain relief. Our clinical team is certified in neonatal resuscitation. We also administer routine medications to the newborn, such as vitamin K and eye ointment within an hour after delivery. We do not offer any vaccinations. The parent's pediatrician of choice will provide vaccinations according to the parent's care schedule. Newborns are required to see a pediatrician around 24 to 48 hours after discharge. We do have many local and out-of-area recommendations depending on what the parents are deciding type of care they would like. This is a little bit about nitrous. We just got this in 2024. It does start working in less than a minute. There are no adverse reactions to baby. You're able to move around. You're able to use it in the tub. You can use it while you're sitting on the ball. The patient is actually controlling what's being administered. We can titrate it up or down depending on the relief and what the patient is wanting. This is kind of what it looks like on your birthing day. Upon admission in active labor, we will allow 2 support persons to come alongside you. Some exceptions are made depending on a case-by-case basis, but we really try to stick with just 2 people along with the birthing mother. Doulas are highly encouraged, especially for first-time birthing families or first out-of-hospital birth families. We do limit traffic in our facility, so we are unable to provide a waiting area for outside friends and family during labor and offer only in-person tours once you come in for your first in-person visit around that 10 to 12 week mark. During labor, the midwife will monitor both mother vitals and baby's vitals all throughout the labor process. Patients are encouraged to move, hydrate orally, and have some light snacks. We use a lot of water, so showers, tubs. That really helps with some pain relief. We always offer delayed cord clamping, natural expulsion of the placenta, Immediate skin to skin is kind of the standard of care for midwives. We do a complete newborn examination, vitamin K and I prophylaxis after your initial bonding time, and breastfeeding. We do offer registration for birth certificate and social security number. All that application worksheets will be done before you're discharged. The average stay post-delivery is 3 to 6 hours. It really depends on how labor went, how long mama was awake, if there's any complications. Typically, longer stays are more for rest, but most of our moms are out definitely before the 12-hour mark. In the event of a transfer, depending on your case, the midwife will call ahead to the receiving facility. The report is given to a charge nurse and triage. We also will talk to an OB or midwife on the floor if they are available to give your case report to. In this setting, your midwife is no longer your provider for delivery. So we kind of have to hand you over to the hospital, but we are available over the phone to answer any questions or maybe go over different options that you may have available to you. And this is why we highly recommend having a doula. This doula can go with you in the event that the transfer is needed. Higher risk patients are transferred out to Advent Health Orlando or Winnie Palmer. Both of these hospitals have NICUs. The majority of our transfers are non-urgent cases in labor, such as a stalled labor pattern, prolonged release of water, with the absence of progressing cervical change, just to name a few. Most urgent matters, we utilize EMS ambulance for transport. This is reserved for patients needing close vitals monitoring, or maybe you're having some IV fluids with medications on board, or oxygen is needed. Our local hospital is Advent Health Waterman. It's approximately 7 minutes away by private car, so EMS can usually get us there a little quicker. Upon discharge, your midwives can resume care for all your routine postpartum care. If you did end up in a cesarean, we can do incision checks, things like that. New for coming up in July of 24, we are including childbirth education as part of our package. We are seeing a lot of families not partake in classes because they don't want to pay for them, and we are seeing less birth satisfaction because of less education, not for the care that is being received. Ms. Ashley Jass is our educator. She will be the one helping you get registered for classes. She is an awesome mother of 6. She has been out of hospital for all of her births. She's been a doula. She's been a breastfeeding educator. She's kind of like one-stop shop when it comes to education. So with these classes, you'll have an increased confidence, a decrease in fear for labor. Partners have better satisfaction as well. It leads to decreased need for pain medication in labor, increased satisfaction with your birth. It does help improve communication between women and the care providers. Overall, attending childbirth classes can help you experience a more enjoyable birth, as well as your partner feel more prepared and less fearful. Ashley will go over the stages of labor, how partners can support moms from pregnancy throughout the postpartum period. She'll talk about optimal positioning for baby to help make labor go a little smoother, comfort measures, hands-on practice, different choices you have for birth, and then getting you prepped for postpartum and breastfeeding. The classes are required for all first-time parents and first out-of-hospital birthing parents. However, we encourage all birthing families to take this course. The first portion is a 6-hour online self-paced course, and then we offer a hands-on session at the end of that. It's a one-time 4-hour course with several other couples, generally every other month. We also have a Zoom option for families that are unable to make the in-person. This slide goes over a little bit about evidence on birth centers and care that is received. There is a study linked on there, but basically the bottom line is our C-section rate is in general less than 6% for birth centers. And if you see over on the right-hand side of that slide, ICANN is a education support and advocacy group for all over the U.S. But in Florida, they are seeing 37.4% of births in Florida are cesarean. So us as midwives, we are trying to decrease that number by still offering the best possible outcome and care for both mother and baby. We are proud members of AABC, which is American Association of Birth Centers, the National Association for Certified Professional Midwives, as well as the Midwives Association of Florida. So a little bit about our building here. We are located in downtown Eustis, Florida, on the corner of Orange Avenue and Eustis Street. It's a big old white building on the corner. It has murals on the side. There is parallel parking, as you can see in the picture out front. Those do fill up pretty fast. There is actually a parking lot on the back side of the building. It's just across from Ace Hardware. There's also an adjacent parking garage, and there's additional parking down the street. We have a separate admission parking area when Labor Day actually happens, so you're not wandering around trying to find parking. Families safely travel up to an hour or more for our facility. It really depends on what baby number this is for you. I've had women drive as far as 90 minutes to get to us, but ideally an hour or less is what we're looking for. So once you get into that building, there's a main corridor inside. We are number 14. You just follow the little footprints on the door. We are open for prenatal clinic Monday, Tuesday, and Wednesday only by appointment. And then your midwives are on call for you 24/7. This is our waiting room / classroom. We do offer education for different providers and professionals. We've done spinning babies classes, we've done CPR, we do neonatal resuscitation. So it's a really fun open space. We can easily move furniture around to get upwards of 20 people in here comfortably. And then we have 2 exam rooms. The midwife rooms are very comfy. We have a little couch in there we sit on. We have exam tables in there. And we have a little toy area for the kids to play. And then we have 2 birthing suites. Number 1 offers a more open concept, very large tub in there. It has a pillow top mattress. We have an additional seating with a pull-out sofa for support persons. This room is really great for first-time families or families that are bringing in extra support persons just because there's more space. And then birthing suite 2, I've already changed it since this photo was taken. The color scheme is the same. I did upgrade the tub, so it is a Aqua Doula professional birthing pool that has a heater built into it to keep the temperature at a constant 101 degrees to be safe for baby. And then you have a full-size bed with a pillow top and a walk-in shower. We do make custom teas and herbs in our facility. I'm a big fan of herbal tinctures and trying to treat things as naturally as possible. I do make our own pregnancy tea. I make afterbirth sitz baths to help you heal. We have lactation support tea. I have a relaxed tea as well as a anxiety tincture and some labor prep. We also offer lending library with belly wraps, DVDs, books, things like that. We do offer in-house placenta services only for our patients. Reason being, I want to make sure that everything is done as safely as possible. But placenta services, typically that includes dehydrating and encapsulating. Most of the studies out there are anecdotal, but it does help promote a sense of well-being, helps with postpartum mood disruption, hormone imbalances. It can shorten postpartum bleeding, and it may actually help with milk supply. If this is something you're interested in, we can give you a handout for. But again, this is something you would need to research. It is not recommended for every family. A little bit on the money side, we are in network with most Blue Cross and Blue Shield, Florida Blue plans, Anthem, Aetna commercial plans, and then we do accept Medicaid in the form of Sunshine Health only. We do not bill out of network. However, we can offer CPT and diagnosis codes with billing information if that is something you want to do on your own. We do accept health share plans, and again, we give a blanket letter of codes and things like that that need to be for reimbursement purposes. We do accept flex accounts, HSA cards, and we also offer financing through a company called FlexBuy. This is for packages that include everything if you need it, and you can make longer term payment plans with them. Out-of-pocket expenses are dependent on your maternity coverage and benefits on your individual insurance plan. An estimate will be provided prior to your initial visit upon review of your registration and insurance member information. Final verification of insurance coverage and prior auths will all be performed by our insurance coordinator, Holly. Additional fees outside of insurance will also be assessed and included in your estimate. All patients, regardless of insurance coverage, will have a concierge fee applied to the balance in the amount of $1,250. An initial deposit is due at your first visit, and that's $250, and that's in order to establish you into our care and retain your birth month. This is a non-refundable fee, and it will go towards your out-of-pocket. All payments are due by 36 weeks. These can be broken down or paid in a lump sum. Full financial contract will be reviewed with our insurance coordinator, Ms. Holly, and she will go over a payment plan with you. And then this is the wellness center next door. Again, Dr. Bonnie, she is with Spa Chiropractic and Doula Services. She offers quite a bit of things, as well as we have a licensed massage therapist that works with her next door, Marlise. So they're a great little team. And we like to have all of our patients see her if at all possible. Thank you for your interest in midwifery and birth center care at our facility. To initiate care with our practice, a phone consultation will be performed by one of the midwives. This is a quick phone session. We will discuss personal risk factors, determine eligibility for care in this out-of-hospital setting. After determining acceptance to the practice, you will receive several emails through our electronic health portal. It's an app called Mobile Midwife. You will always have access to all of your records. You will need to complete all of the tabs for demographics, medical, family, OBGYN history, as well as review and sign any documents, definitely ahead of your initial appointment. You will have access to our chat feature and message feature for non-urgent matters, direct to your birthing team and office staff beyond normal business hours. You also get a second email from us. This is called our welcome email. This package includes our education binder, a handout called Real Food for Pregnancy, instructions on when and how to reach your midwives 24/7 via text or phone. You have direct access to your providers for any medical questions or concerns. Well, thank you again. Hope to hear from you soon.